Digestive disorders affect millions of people of all ages men, women, and children. In 2020 alone, data reveal astounding worldwide figures. 4 out of 10 people have functional GI disorders, or an estimated 40% of the global population. Last year, there were more than 1.9 million new cases of colon cancer, the third most diagnosed cancer in men and the second in women. Over 1 million new cases of gastric cancer, the third most deadly type of cancer. And at least 900,000 new cases of adult liver cancer, the fourth leading cause of cancer mortality in the world. The good news is, we can work together to help lower the risk for patients. Digest the latest updates on GI care in a 4-part series of discussions with the experts. Tummy Talks. Here are your hosts, Dr. Benjamin Perez and Dr. Mike Oliman.
Good evening. Welcome to the third episode of Tummy Talks. Ito ay third episode na namin at nakadaan na kami ng 2 episode na hopefully marami kayong natutunan at na gustuhan sa mga pinagpaalam namin sa inyo.
Yes, this is actually our third episode already, and there are a lot of viewers already from the previous sessions, and we're now very excited to be part of this, to be able to impart to you more knowledge about gastrointestinal problems.
Ngayon, nakakita ninyo na wala kaming nakasuot na mask ngayon dito. Ito ay para maintindihan ninyo mga sinasabi namin at malinaw sa inyo. But rest assured, lahat ng mga nandito sa studio, pati kami ay naswab na at lahat ng health protocol in-observe ho namin.
And even with these health protocols, we are still doing physical distancing at this time. Nandito naman po tayo para sa isang napaka-interesting na discussion. This time, focusing on Helicobacter pylori or H. pylori and gastric cancer.
I'm sure some of you are wondering, ano ba ang H. pylori? H. pylori is a type of bacteria found in the stomach or the digestive tract. Well, some of these bacteria enter the body, usually starting way back from childhood and throughout life. About 2/3 of the world's population have H. pylori infection without knowing it kasi wala namang sintomas.
H. pylori infection does not cause illness in most infected people, although through the years, it could lead to conditions such as peptic ulcers or even gastric or stomach cancer. Based on Globocan data, gastric cancer is the 5th most common neoplasm and the 3rd most deadly cancer worldwide. Aside from the burden of the disease itself, malaki din ang social impact and economic impact ng cancer na ito.
Cancer in general represents the largest single drain on the popular economy compared to other causes of death.
This is because stomach cancer, just like other cancers, has a huge impact on economic resources and opportunities for patients and their families, including their employers and society as a whole. Not to mention reduced quality of life and reduced productivity.
Mukhang marami-rami tayong mag-uusapan na matutunan ngayong gabi. Kasama natin ang aking mga eksperto.
I was never the type to slow down. I always wanted to do more. Now, they tell me I'm too old for that. Old? I can't feel it. Break free from weakness with the help of Ensure Gold. With HMB, protein, and 28 vitamins and minerals. Now in a ready-to-drink bottle. Stay strong.
Ang overeating ay pwede maging cause ng heartburn at indigestion. Mag-Gaviscon Double Action. It neutralizes stomach acid at bumubuo ng protective layer para mapigilan ng acid reflux. Para sa dual relief from heartburn and indigestion, Mag-Gaviscon Double Action. Ang overeating ay pwede maging cause ng heartburn at indigestion. Mag-Gaviscon Double Action. It neutralizes stomach acid at bumubuo ng protective layer para mapigilan ng acid reflux. Para sa dual relief from heartburn and indigestion, Mag-Gaviscon Double Action.
For our first speaker for today is Dr. Maan Lotok, who will be talking about Helicobacter pylori infection.
Hello, Maan. Welcome to Tummy Talks. Thank you for gracing us with your presence today.
Thank you for having me, Benj, Mike.
Okay.
And welcome to our viewers today for the Tummy Talks.
Okay. So, Dr. Maan, so a lot of people are asking, so we mentioned earlier kasi that Helicobacter pylori infection can infect the stomach from as early as childhood. Now, ang question nila is, paano ba natin nakukuha ang Helicobacter pylori infection in the first place?
Well, there are several researches already done over the years, and two most common would be direct, person to person, like through saliva, or oral ingestion, we call the fecal-oral route, meaning contaminated food and water.
So, the risk for H. pylori infection galing sa pagkain o personal hygiene?
Yes, So, as you mentioned, it's very important sanitation, personal hygiene, because you can get infected as early as childhood, and the infection persists until adulthood, So, ano ba yung mga risk factors for this? Would be overcrowding, kasi syempre, poor sanitation, if you don't have clean water, and also if yung sa environment mo hindi malinis, and then there's a lot of you in the household, So, these are the risk factors, and naman in developing countries, these are the conditions that we have. Poor sanitation, poor hygiene, overcrowding.
Tama, yun nga.
That's why it's common in the Philippines.
Yes.
So usually, whenever we get to be infected by bad bacteria in our body, usually kasi din na re-recognize na niya ng immune system natin and natatanggal din. Why is it na magkakaroon tayo ng infection ng Helicobacter pylori, nakaka-persist siya sa ating tummies?
Well, kasi yung H. pylori, it's true, Your immune system normally reacts to anything that is outside of the body or foreign to the body. But this particular bacteria, meron siyang ways to navigate yung immune system natin, Para malampasan niya yung defenses that we have. That's why it can stay from childhood, They can get it early. Usually, they get it from as early as 8, or even younger, And then they don't know they have it until adulthood.
So, millions of people might have this infection and not even know it, kahit na adult na sila.
Yeah.
So, anong pwede mangyari? Mga komplikasyon or mga sakit na pwede nila makuha dahil dito sa H. pylori?
Because nga, it stays with them a long time, Yung bacteria kasi, what it does not really invade, yung lining ng stomach. Actually, nagtatago nga siya dun sa protection, which is the mucus.
Right.
There's a mucus that protects our lining from the acid in the stomach. Ang ginagawa niya, nagtatago siya doon. But it releases substances na nag-a-attack or nagkukos ng damage sa lining. So what do we see? In patients with long-standing infection, you have gastritis. More than 90% ng mga pasyenteng may H. pylori, may gastritis. Ano ba to? Ito yung namamaga yung lining ng stomach. And pagtagal nito, it can also lead to ulcers.
Right.
And later on, also gastric cancer.
Okay, so Doktora, given these complications and these things na pwedeng magawa, apart from yun nga, trying to prevent it through hygiene nga, tulad ng sinabi ninyo, ano pa bang may papayo nyo sa mga other people, mga ating mga viewers regarding kung ano yung mga gagawin nila to be able to, para malaman kung meron silang Helicobacter pylori para hindi din umabot dun sa mga ganong complications?
Yes. Well, first off, kasi kung may mga sintomas ka, And sometimes yung symptoms tulad ng pagsakit ng tiyan, pag-bloat, no? Parang uncomfortable, it doesn't mean automatically may H. pylori ka. So what's important is for you to consult your doctor, no? And to consult your doctor and para ma-determine, no? Ma-discuss sa'yo kung ikaw ba ay kailangan ng testing. Kasi hindi yan basta ginagamot lang, no? So you have to be tested. And if you are a candidate, no, to be tested, meaning may symptoms ka na posibleng dahil sa H. pylori, then you need to be tested, no? And that's the thing that you need to discuss with your doctor.
Tama.
Okay.
Kagaya ng sinabi ni Dr. Alonto, kung you think meron kang H. pylori infection, you may benefit from getting tested. So ito ang next topic natin dito sa Tommy Talks. Thank you, Dr. Maan, for being with us this
Thank
day.
you, Pat.
Thank you.
SB Moore Group of Companies is unflinching in its commitment to provide high-quality, value-driven, and cost-effective pharmaceutical products to help the Filipino live longer, healthier, and more productively. Our purpose will always remain unchanged: to make a life-enhancing impact on the Filipino.
Now, for the second part of our third episode of Tommy Talks, we're now joined by Dr. Sandy Prodigalidad to talk about how we can detect and eradicate Helicobacter pylori infection.
Hello, Sandy.
Hi, Benji. Hi, Mike. It's nice to
Hello.
be here.
Thank you for joining us.
Thank you. Thank you for inviting me.
Earlier, we established that Helicobacter pylori can lead to conditions such as ulcers, gastritis, and even gastric cancer. Anong sintomas mag-indicate sa'yo na mayroon ikang H. pylori? Kasi ito kung gustong malaman ng mga tao natin para sila matest o makita kung meron silang infection na to.
Well, alam mo, Benji, when you have H. pylori, usually yun yung mga pasyenteng nakakaramdam ng sakit sa sikmura. They have upper abdominal pain, they feel bloated, they feel a little different, masakit ang tiyan after they eat. No? So those are the typical symptoms of H. pylori. It's like you have hyperacidity. When they say hyperacidity, yun nararamdaman mo.
Tama, almost the
Oo.
same.
So, these patients, pag hindi sila gumagaling, no, or kung binigyan na nga sila ng gamot, pero hindi pa rin epektibo, so sila yung mga patients na pinagsususpetsyahan natin na baka merong H. pylori. So, we want to test them. That's when you test. When it appears like kailangan na nilang ng tulong bukod dun sa pangunang binigay ng doktor.
Okay, so just as a, para lang po ma-clarify lang natin, no? So, sino-sino yung mga people na kailangan matest for Helicobacter pylori? Lahat ba ng, basta't meron ka na bang sintomas ng Helicobacter pylori infection, kailangan na ba talagang ipatest for Helicobacter?
Actually, hindi naman. Kasi kung napakadaling gamutin, no? Binigyan ka ng simpleng gamot para sa acid, no? Mga gamot na nakakababa ng acid, tapos gumaling ka, hindi naman siguro. So, we reserve our testing for the patients na hindi gumagaling despite appropriate treatment.
O kaya hindi lang acid ang naramdaman nila.
Oo.
Ano pang mga test na to na kailangan nilang magawa?
Okay. So, when the doctor decides that they need to be tested, merong iba-ibang testing na pwedeng gawin, no? Una, meron tayong blood test. So, kukunan po sila ng dugo. Pangalawa, meron tayong breath test. It's called a urea breath test, no? So, ang nangyayari, binibigyan sila ng gamot, no, na urea, iinumin nila. Tapos, after a while, yung mga pasyente, they are asked to blow into a device, no? Tapos, itong device na ito, yes, ilalagay nila yan sa isang machine, no? And that will say kung meron siyang H. pylori or wala. That's the urea breath test. Then we have another test. It's called the stool test, the stool antigen test. Kailangan nila magbigay ng stool sample, tapos ito naman ang i-analyze at pag-aaralan sa laboratorio, and if it appears like meron nga siyang H. pylori, then bibigyan siya ng gamot para sa H. pylori. No, magpa-positive yon kung meron H. pylori, negative kung walang H. pylori. Pero bukod doon, meron din naman tayong testing na mas defined. Ibig sabihin, mas sigurado tayong H. pylori. And ito ay sa pamamaraan ng endoscopy. No? Kung hindi niyo alam kung anong endoscopy, ang endoscopy ay yung procedure where we have a thin tube that has a camera. No? It goes down the mouth, the esophagus, and down to the stomach. So makikita natin yung laman ng tiyan, yung lining ng tiyan.
Picture ng
Yes, may picture, may video sa loob, tapos we can take biopsies. Tapos yung na-biopsy, yun ang pag-aaralan. At makikita natin kung may H. pylori or wala.
Tama. So yung biopsy na kinukuha natin ay small tissue lang, hindi naman ng tao pag kinuha natin, di ba?
Ay, hindi nila mararamdaman.
Okay. So now kung sakaling masabi ng doctor ng pasyente na kailangan nila ng endoscopy to be able to detect whether or not there's H. pylori or other things na nandun sa stomach nila, ano yung mga kailangan isipin ng mga pasyente na kailangan preparations for those procedures?
Okay. Iba-iba. Depende sa test na ini-request ng doktor. So, if the doctor recommends an endoscopy, no, usually we ask the patients to stop certain medications, especially mga gamot like blood thinners, no? Kasi may balak tayong mag-biopsy and we don't want the added risk of bleeding. So that's one thing. But immediately prior to the procedure, we ask our patients to not have anything to eat or nothing to take by mouth because you want the stomach empty, hindi ba? Para pagpasok natin, wala nang laman, maayos yung proseso. Mga 8 hours, sometimes 6, depends on the doctor really, but 6 to 8 hours would be enough. Now, if you're talking about preparations for the other tests, for the blood test, walang preparation na kailangan, no? You just come for the procedure. For the breath test, the patients are asked to stop taking any medications like antibiotics for at least a month. And then if they are on acid reducers, they're asked to stop those medicines for 1 to 2 weeks. And then they go to get the test at the time of their appointment, no? Maybe they're asked to fast for about an hour before the medicine or the agent is given to them, then they do the breath test. For the stool test, wala namang preparation in terms of kakainin or iinumin, pero ganun din, they shouldn't be on antibiotics for at least a month, and ganun din, we ask them to stop the acid reducers for the 1 or 2 weeks before the test.
Tama. Kasi itong mga gamot na to, na para sa acid, pwede maging negative yung test kahit na may H. pylori ka.
Yes.
So, sa endoscopy naman, ano mga tests ang gagawin natin? Sinabi mo yung biopsy. So, dun sa biopsy, ano mga tests ang kasama dun?
Okay. We have 2 types of tests, no? Yung una, yung ating bedside rapid test, no? We get specimens and then we put the specimen, the tissue specimen, in a small piece of test paper. It's called a test paper, like a litmus test, no? So the tissue is put there over inside that small test strip, and then we wait 5 minutes, then it turns a different color if the patient is positive for H. pylori. Ngayon, pwede din naman na kukuha ng tissue tapos ipapadala sa pathologist. Titingnan po ng ating pathologist under the microscope kung meron pong H. pylori or wala. So, yun ang different tests na pwede, but they differ, no? Depende sa pangangailangan at saka kung anong sa palagay ng doktor na naayon dun sa kaso ng pasyente.
So, kunwari, after all of any one of these tests, no, na nakuha ng patient and na-confirm na meron talaga siyang H. pylori, kaya ba nating ma-eradicate ang Helicobacter pylori sa katawan ng isang tao?
We can. May gamot naman sa H. pylori. And they usually entail still taking the acid reducers, no? Pero merong antibiotics. Pangkaraniwan, they take the patients are given 2 antibiotics together with the acid reducer, right? Depends on what medicines are given, but usually they can go from 7 to 10, even 14 days.
So, granted na binigay mo ng gamot yung pasyente, ininom niya, tapos mukhang successful yung pag-treatment niya at eradicated yung H. pylori sa kanya, how will the person know kaya na hindi na siya at risk? At risk pa ba sila to develop the complications like you have gastric cancer?
Well, pag na-eradicate na nila yung organism, if it is proven, no? Kasi pwede tayong mag-test ulit. Babalikan natin yung pasyente, iti-test natin, titignan natin kung positive pa ba siya or negative. Kung na-eradicate, pangkaraniwan, the risk is very low for getting gastric cancer. However, kailangan po natin tandaan na pwedeng kung matagal na po siya nagka-H. pylori, may pagbabago nang nangyayari dun sa lining ng stomach, no? At itong changes that we observe, sila po ang pwedeng maging risk factor for cancer of the stomach. So, it's possible that you still carry the risk factor even if the bacteria is already eradicated. Pwede pa rin siya. Now, kung na-endoscopy ang pasyente at alam ng doktor na meron siya nitong mga changes, no, babantayan siya. Merong appropriate timing, merong interval to a next endoscopy, titignan lang. Pero ang maganda sa pag-check, no, pag maaga mong nahuli, madali naman agapan. May magagawa pa rin naman.
Importante talaga yung early detection talaga.
Yes.
So maraming salamat, Dr. Sandy, no, for our talk. No? Magbabalik si Dr. Sandy later for our Q&A.
Did you know that the liver is key to a happy life? At ang paminsan-minsan can add up and affect your liver's ability to detox? Take Essentiale, #1 and doctor-prescribed to protect the liver. It's made with phospholipids from soybeans and has triple action formula that helps regenerate, strengthen, and protect your liver, so it can detox daily. Essentiale, love life with all of your liver.
So, welcome back. We are in the third part of our third episode. At kanina pinag-usapan natin yung H. pylori na pwede itong ma-detect at ma-treat, pero dapat inumin nyo ang gamot ninyo as prescribed by your doctor, kahit na wala na kayong nararamdaman. However, if nandito pa yung H. pylori sa inyong katawan, pwede mag-worsen ang nararamdaman ninyo. It can lead to peptic ulcer or even gastric cancer.
Okay, as was mentioned earlier, H. pylori infection can actually lead to gastric cancer, no? So, to talk to us about gastric cancer, we have here Dr. Peter C. To talk about gastric cancer. So, Dr. Peter C., first question is, ano po ba ang gastric cancer?
Gastric, medical term stands for stomach. So when we say gastric cancer, we are referring to stomach cancer. And this refers to the presence of an abnormal mass which begins in the stomach. And this is not just an ordinary benign tumor, but a malignant tumor which, of course, has aggressive behavior and can kill the patient.
Now, H. pylori, Peter, has been identified as a major cause of gastric cancer. Ano pang ibang risk factors na pwede mag-lead sa gastric cancer?
Aside from the H. pylori, which is the leading cause of gastric cancer, other risk factors include gastroesophageal reflux, yung heartburn. So heartburn refers to effortless movement of the acid to the esophagus. And this can lead to inflammation of the esophagus and some changes which can eventually lead to cancer of the stomach. Another is diet, which is very salty, processed food. So this can lead to gastric cancer. Examples are the soy sauce, pickled fruits and vegetables. Another factor is
Kinakain ko yan.
yeah, diet deficient in fruits and vegetables. So you have to eat a lot of fruits and vegetables. Not just fruits and vegetables, it has to be fresh fruits and vegetables.
Di pickles.
Dapat galing sa puno na bagong pinitas. Or it should have been refrigerated. Hindi yung nabubulok na.
Di yung mga sakan pa lang.
Yes. So processed food is a risk factor
Yes.
for gastric cancer. Smoking.
Yes.
The heavy smokers, the current smokers, those who begin smoking at an early age, put them at an increased risk for gastric cancer. Also, obesity, eating of fried foods, amount and the quality of food matters also. Also, age. Mahirap talaga tumanda, no?
Oo.
Buti bata pa tayo. So, gastric cancer affects people usually older than 72 years old. But of course, nobody is exempted from gastric cancer. Intestinal metaplasia, pamamagaan ng stomach, sikmura, gastritis, is also a leading risk factor.
So if ever po, ano po ba yung mga possible na symptoms na mag-iisip tayo na baka meron tayong stomach cancer?
Symptoms of gastric cancer include bloatedness, parang mahangin ang tiyan, early satiety or konting kain lang, parang nabubusog na yung pasyente. Because if you have a tumor in the stomach, parang palagi may pagkain, di ba?
Right.
It will affect the lining of the stomach, so the stomach becomes less elastic. So, konting kain lang, the patient feels full already. Other symptoms are nausea, nasusuka pagkatapos kumain. Because the stomach tumor may be found near the outlet. So, mahirap lumabas ang pagkain. So, nasusuka yung pasyente. Also, weight loss. Of course, kung nagpapapayat tayo, talagang doesn't mean na may cancer.
Yung unexplained weight loss,
Yes,
kumbaga.
unexplained weight loss, and the weight loss should be progressive.
Yes.
So one thing important to note is most cancers of the stomach are silent,
Yes.
walang sintomas.
Yes.
Now, by the time may sintomas na yung pasyente, medyo malala na yung condition. 80% of patients with early gastric cancer will not have any symptom at all. Another symptom is, or sign is anemic. Parang namumutla because tumor will bleed. So parang araw-araw nababawasan ang dugo natin.
Unti-unti.
So the patient becomes anemic. So he or she feels faint. So maputla. Of course, you need to lose at least 50 cc of blood bago makita na yung pupo natin ay naging itim. Kaya kung itim ang dumi natin, unless kumain tayo ng isang basong o isang platong dinuguan, talagang mangitim ang dumi. Or if you're not taking any iron supplement, iron tablet, so there's no reason why your stool should become black. So those are the basic signs and symptoms that the patient should look for.
So, Doc Peter, sabi nyo nga, maraming mga patients na maaaring walang mga sintomas. So, we would want to talk about kung paano ba siniscreen out yung mga patients na merong gastric cancer. Sino ba yung mga kailangan i-screen and how is it done?
Screening for cancer means that you try to detect or catch the cancer at an early stage, even before the symptoms or signs appear. The idea there is to catch the cancer or detect it early so that the cancer can be properly treated. Of course, the earlier the treatment, the more successful the outcome. The most important test is the endoscopy, upper gut endoscopy, where you insert an instrument, a tube na around 1 meter long. The caliber is around 5 millimeters.
Maliit lang.
Flexible, no? Kayang-kaya, parang kumakain ng lumulunok ng matigas na spaghetti. No? So this is introduced through the mouth and advanced to the stomach. There's a camera, so you can directly visualize the lining of the stomach. No? You can examine the cells by biopsy, and you can confirm whether there are abnormal cells which may suggest gastric cancer. Of course, all of you are familiar with ultrasound. Ultrasound is our favorite. Na? Ultrasound, number 1, mura. No? Hindi siya mahal. Walang radiation. No? And it is non-invasive. Unfortunately, the test cannot detect cancer of the stomach because our stomach is full of air. No? So kung maraming hangin, kalaban ng ultrasound ay hangin. So you can see practically nothing from ultrasound. How about CT scan? CT scan, medyo mahal. No? May radiation. Of course, non-invasive. But this cannot detect tumor in its early stage. No? 5 millimeters, madalas namimiss yan. No? MRI, mas mahal pa kaysa CT scan. No? A little radiation, but the detection rate is also not as high. No? Of course, CT scan and MRI are good for staging. Nung kung medyo advanced na yung bukol,
May nakita na.
makikita natin. No? Pero yung small lesions, if you aim for the early detection, CT scan and MRI are not good tests. No? Of course, there's a test called the X-ray, the barium swallow, where the patient will be asked to swallow parang dye, no? Paste, barium paste. No? So this will coat the stomach. So sometimes you'll be able to see abnormalities. But you still need endoscopy to confirm your finding because the accuracy is not as high as the endoscope.
So tamang ang endoscopy ang pinaka number 1 na screening na kailangan gawin.
Yes. This is invasive, a little bit expensive, but I think that's the best test.
Yes. So kunyari, nakita mo na may possible cancer yung pasyente. Sa biopsy, positive siya. Anong pwedeng gawin na treatment para sa mga to?
Gastric cancer, you have to know that walang gamot na makakatunaw ng cancer. Now, there's no medicine which can dissolve the tumor. So the best treatment is complete curative resection. Dapat tanggalin ang bukol.
Surgical.
Yes. But you have to know that even after surgery, because gastric cancer is one of the most aggressive cancers, even if the procedure is successful, the survival rate, 5-year survival rate is around 50 to 60%. Mababa ang survival. So sometimes you can do surgery for palliation, especially if there is an obstruction. But you try to remove as much tumor as possible. So you know about chemotherapy. Chemotherapy, you give medication to kill the cancer cells. So sometimes we use chemotherapy before surgery para lumiit ang bukol, para mas mabilis at mas kompleto ang pagtanggal ng bukol by surgery. It can be given also after surgery. Unfortunately, chemotherapy, you are aware of all the side effects of chemo because chemo will not only kill the cancer cells, it will also kill the normal cells. So a rather new form of treatment is targeted therapy. Targeted therapy where you use drugs to target the genes and protein which are involved in the survival and growth of cancer cells. Another is immunotherapy, where you give treatment using medicine to boost or use the patient's immune system to kill the cancer cells. Radiotherapy is not very effective but can be combined with chemotherapy and surgery. Basically, it's useful for treatment of patients' pain, obstruction, and other complications of the cancer.
So, Doc, you mentioned earlier na medyo pangit yung ating yung long-term survival ng mga patients with gastric cancer, no? So, I think ang mas importante na mapag-usapan natin how is it that we can prevent having stomach cancer in the first place?
Stomach cancer, fortunately, only 5 to 10% of gastric cancers are related to genetics. So 90% is acquired or environmental. So there are a lot of things that we can do to prevent cancer. Of course, an ounce of prevention is worth a pound of cure. Number one, as was mentioned, H. pylori is the leading cause of gastric cancer. So if your patient complains of ulcer-like symptoms na hindi gumagaling sa medication, especially kung may weight loss, pangangayayat, anemia, no, or early satiety, mabilis mabusog, so mapatingin sa doktor. The doctor may recommend endoscopy to properly examine the lining of the stomach. Number two is to change our eating habits. Decrease intake of salty, processed foods, and eat more, again, fresh fruits and vegetables. Lifestyle modification, importante rin yan.
Yes.
No? Smoke less, exercise more.
Yes.
And of course, go for early detection. No? Patingin ka agad kung may hindi magandang naramdaman.
Do you have any final message about gastric cancer na pwede natin ipahagi to our viewers?
Gastric cancer is, I would say, preventable. So early detection is the key. So when it comes to cancer prevention of the stomach, what our parents told us or taught us is very applicable. Yes. What we need really to learn, we learn already in kindergarten. So eat healthy, exercise more, smoke less, and see your doctor.
Thank you, Peter, for all that important information on gastric cancer. Please stay around. We'll have a Q&A next.
Thank you, Benj. Thank you, Mike.
Welcome back to Tommy Talks. This is the last part of our third episode. This is the question and answer portion. Dr. Peter C. is now joined back with Dr. Sandy Prodigalidad and Dr. Maan Lontok. Welcome back.
Okay, so for our first question, a lot of our viewers are asking, no? Kasi parang merong mga mahihilig kumain ng mga maanghang at saka maasim, no? So, natanong nila if spicy food and stress, can they cause ulcers of the stomach?
It may, no? It may cause ulcers, pero mostly they irritate existing ulcers kung meron na, no? Kasi they are irritants sa lining ng stomach.
Okay, sige.
But other than spicy food, siguro what I want to add is that marami din sa mga patients natin would have other risk factors, no? For getting ulcers or kaya yung mga symptoms that may be attributed to gastritis, or other conditions sa stomach.
Apart from yung mga spicy food nga, maraming mga nagtatanong din kasi regarding caffeinated beverages and carbonated beverages. What can you say about those things?
I think it can aggravate, although yung studies kasi on, for example, coffee, hindi very strong. But they're saying it's because yung mga patients na tinanong nila, they were advised already na meron silang gastritis and ulcers and have cut down already.
Right.
So, wala silang nakita talagang benefit. But the more important risk factors would be yung mga umiinom ng mga pain relievers.
Right.
No?
Right.
Yung mga, we call NSAIDs. Yung mga iba't ibang brands that we have in the market, no? So, we have ibuprofen, yung mga mefenamic, basta anything that they use for mga arthritis. Siyempre, we have a aging population, mas marami na may mga arthritis, o kaya when we have pains anywhere in the body, we tend to take this over the counter lang kasi marami, no? So, that's a significant risk factor. And another one is cigarette smoking. In fact, yung studies, kahit one lang a day would increase your risk of getting ulcers, no? O yung mga gastritis o problems sa sikmura.
If I may add, kanina minention ni Maan na stress and spicy food can cause ulcer. Na? Sa mga pasyente natin, when they say ulcer, they mean acidity. Sa amin, when we say ulcer, dapat when you do endoscopy, may makita kang butas. So we have to differentiate that. So ulcer, when you say butas, hindi nakakabutas yung mga spicy food. Pero nakaka-acidic. So what they mean by ulcer sa lay people is acidity.
Dapat i-distinguish nga itong dalawa when you talk to your patients. No?
Right. Agree.
So, we have another question about H. pylori testing, no? Kung ma-treat yung H. pylori after na-treat siya, how often should they see the doctor?
Well, normally, the patients, after silang matreat, nawawala yung sakit ng tiyan. So, kung wala na silang nararamdaman, tapos na. No? But of course, like I said, minsan, merong mga dahilan kung bakit kailangan silang mamonitor. Like if you have H. pylori at na-endoscopy ka at merong nakitang pagbabago, the changes along the lining of the stomach that might predispose you to getting cancer of the stomach, then you'll have to see the doctor. So, sasabihin naman ng doctor sa inyo kung kailan ka babalik para matingnan niya ulit kung nagbabago pa ba, nag-e-evolve ba yung lining dun sa stomach na baka kailangan ng may biopsy, kailangan ng may tanggalin, no, na bahagi ng wall ng stomach. No, but those are far advanced cases na. No? So, pangkaraniwan, pag nagamot na sila ng H. pylori, nawawala na yung sakit ng tiyan nila, hindi naman na nila kailangan pumunta sa doktor.
Okay. Pero basta pag sinabi sa'yo, bumalik ka, babalik ka.
Oo. Yun ang pinaka-importante talaga. No? Huwag kalimutan bumalik sa doktor pag napayuhan ka na bumalik ka.
There's an interesting study which showed that after mamatay yung bacteria, after ma-eradicate, hindi naman siya kagad babalik. The soonest time is 3 years na for the bacteria to recolonize the stomach.
Kung sakali man.
Oo. Kung mayroong taong kasama mo na meron din.
Yes. Okay.
So, isa pang question from our viewers is, kapag naoperahan po ba for gastric cancer, posible bang tanggalin yung buong tiyan? Dr. Peter C.
Yeah. So, depende kung nasaan ang bukol. No? If the cancer is located in the upper part of the stomach, or if the involvement is very profuse or diffuse, then the whole stomach should be removed. No? But if the tumor is localized in the distal part, malapit sa may bituka, sometimes you can just remove 2/3 of the stomach. After that, i-connect ang esophagus or part of the stomach with the intestines.
At saka hindi din siguro, as if I may add, no? Hindi lang yung kung nasaan. Isa din is kung anong klaseng bukol siya. Minsan, titignan yan sa microscope para makita kung ito ba yung agresibong klase ng bukol. And sometimes, kahit maliit pa lang, they might recommend mas malaking portion ng stomach ang tanggalin. So, yun naman i-explain naman ng doktor sa'yo kung may ganung findings.
But I would also like to add, minsan naman may cancer ng stomach na madaling tanggalin ng cancer. Hindi kailangan na operahan at tanggalin ang bahagi ng tiyan, no? There are ways to remove colon cancers, stomach cancer, excuse me, endoscopically. So the doctor can go in and remove that part of the stomach that has what we call superficial cancer, and then after that, the patient becomes cancer-free.
Yeah, that's why it's important nga ng screening.
Yes.
Para makita, pag maaga pa, mas lalo matatanggal na walang open surgery.
Yes, and the stomach, if I may add, ang kapal ng or thickness of the stomach is around 1 centimeter. So maraming layers yun eh. So there are 4 layers. If the cancer is early, meaning ang affected ay superficial layers, the first 2 layers, sometimes it can be removed using endoscopy. But unfortunately, most cancers are already advanced by the time
makita sila.
makita ng doktor. Kaya most of the time, the patient will require some form of surgery.
I might add there na dapat hindi sila matakot kung kailangan ng buong tiyan matanggal. Because it can still be survivable naman.
And the patient can still eat, even
Yes.
without a stomach.
Yes, I have a relative who had the whole stomach removed 40 years ago and is still alive. Esophagus connected to the intestine. So,
Nakakabupay pa ba?
well, oo na naman. So, thank you all for being here in this edition of Tommy Talks. Dr. Maan Lontok, Sandy Podegilidad, and Dr. Peter C. Thank you for your inputs and the answer to your questions that our audience have put in. And I'd like to also thank my co-host, Dr. Mike Oliman. Thank you to all the viewers. Salamat sa inyong pagkikinig. Sana nakuha niyo maraming mga alamin tungkol sa H. pylori at gastric cancer. So we had a very interesting episode and
Yes.
very good experts today.
Yes, very engaging talaga, and I think a lot of us learned about Helicobacter pylori and gastric cancer today, ano? Okay, so just as our final message, no? So first of all, what you need to understand is that H. pylori has coexisted with humans for hundreds, if not thousands of years. And infection with this type of bacteria is quite common. Most people will go through life asymptomatic. However, for some, through time, H. pylori infection can lead to serious conditions such as gastritis, ulcers, and gastric or stomach cancer.
Number 1 sa listahan ng risk factors for gastric cancer ang H. pylori infection. So if you are concerned that you have H. pylori infection and are experiencing symptoms of gastritis and ulcers, please go see a gastroenterologist to have yourself tested and treated.
So lahat tayo, ang kailangan nating maalala is that H. pylori infection can be treated with medications and a healthy lifestyle. Kaya huwag hintaying maging malalang sakit ito, especially maging gastric cancer. And if you have a family history of gastric cancer or at risk for it, have yourself screened. Early detection is still the best way to achieve prevention and to lower your risk for gastric cancer.
Panatiling malusog ang tiyan para masigla ang katawan. Thank you for joining us on Tommy Talks.
Tomorrow, watch out for our final episode and learn about hepatitis, cirrhosis, and liver cancer. Thank you, and this is Tommy Talks.